Hi everyone! Today I'm going to talk all about bladder cancer. Hi everyone! Today I'm going to talk all about bladder cancer. So first we're going to explore what Hi everyone! Today I'm going to talk all about bladder cancer. So first we're going to explore what is bladder cancer, and then we'll go into all the different Hi everyone! Today I'm going to talk all about bladder cancer. So first we're going to Gosh. Hi everyone, today I'm going to talk all about bladder cancer. So to understand what bladder cancer is, we first need to explore what cancer is in general. Our body is made up of millions and millions of cells, and these cells normally grow and divide in a specific controlled way. They have rules on when to grow, when to stop, and when to die according to a program within itself. Sometimes, cells can break those rules due to changes called mutations. They can grow too fast, not stop when they should, and start piling up. When this happens, all the extra cells form masses called tumors. If the lump grows and spreads to places where it's not supposed to be, it becomes cancer. Bladder cancer can happen when these abnormal cells start growing in the bladder. It's actually one of the most common cancers in adults in the US today. Now, what causes bladder cancer? Well, there's no singular cause of any cancer, and that also applies here to bladder cancer. So let's look at some common risk factors. Smoking is a big one because the chemicals in cigarettes can collect in the bladder and damage cells. Age can also be a factor as cancer itself is just naturally more common in older adults. Sometimes the changes in genes of cells, which hold instructions for the cells, can happen and lead to mutations and make the cell act in ways that it's not supposed to. One of those mutations affects a switch inside of cells that controls the growth, and it's called FGFR3. When the switch is stuck in an on position, the cells will grow faster than they're meant to. This does not always lead straight to cancer, but it definitely helps start the process for cancer to form. Now, how is bladder cancer found? Bladder cancer often causes noticeable symptoms that are not normal in day-to-day life, including blood in the urine, frequent urination, or pain when urinating. If doctors think there may be something wrong, they can use tools such as scopes, image scans to look inside the bladder. They can also take samples of tissue called biopsies and test them to confirm whether or not there's cancer present in the bladder. Now, how is it treated? Bladder cancer has several different ways that it can be treated, but the specific ways to treat it depend on how advanced the cancer is. For early stage bladder cancer, doctors can remove the tumor through a small instrument inserted into the urethra, the tube that connects your bladder and allows you to urinate. This is not a major surgery. But if the cancer keeps coming back or it's deep in the wall of the bladder, doctors may need to do a more major surgery to remove part or all of the bladder, but that's an extreme case. A lot of early bladder cancers are treated by putting medicine directly into the bladder through a small tube. It allows the medicine to reach the tumor without affecting the rest of the body. Targeted therapy is another option for bladder cancers with specific genetic changes, such as the FGFR3 mutation that I mentioned earlier. For these cancers, doctors can use a special drug that is designed to shut down the exact part of the cell that is causing the problem. One example of this is a pill approved by the FDA that turns off the switch that is overactive for the FGFR3 mutated cancer cells. This pill basically helps slow down the growth of the cancer and can be used if other treatments are not working. Another exciting area of research is combining different treatments together. Some studies show that combining therapies to turn off the FGFR3 switch can encourage the immune system to work better against the cancer. The combination of treatments in some patients can give a stronger response than just one treatment alone. Now, why does this matter? Even after treatment, bladder cancer can come back, sadly, which can be scary for patients. By learning how the cancer grows and how the immune system responds to it, scientists are finding better treatments and are able to make them more personalized to each patient's different case. New therapies are not only improving the survival rates, but also improving many people's quality of life as they navigate bladder cancer treatment. Bladder cancer is a serious disease, but treatment options are improving every year and doctors have many tools to help patients. As research continues, we can expect even better and even more precise treatments in the future. Even with all this research, there is still more to be done to find a cure. Thank you all for listening. I hope you were able to learn more about bladder cancer.